A medial branch nerve block is a procedure that we do here in our office. The medial branch nerve is a specific nerve that is the nerve supply to your facet joints. Your facet joints are the joints that are formed in your lower back or in your neck or anywhere in your spine where the vertebrae come together. They form a joint on the back side called your facet joint. And these are joints that are going to be potentially painful as you get older. Usually over the age of 40, people start to develop arthritis in their facet joints. This pain will usually be worse if it's for your lower back. It'll be worse when you start to extend your back. It can be worse when you're walking, sweeping, vacuuming, different kinds of activity where you're putting more extension on your lower back. In your neck, it might be even turning your neck or looking up can cause facet joint pain in your neck. Whatever the case being, we will do a thorough physical examination, review your MRI results, take your history, and if we determine that most of your pain is what we call axial or in your neck, if it's for your neck, or in your lower back, if it's your lower back, and not much going down your arms or down your legs, then we might think that your facet joints might be the problem for your pain. And so what we would do is do a test injection, where under an x-ray we would guide a small needle along right next to those facet joints, place a small amount of numbing medicine there, and then we have you go home with a pain diary, and we record your pain over the next 24 hours. And what we want to see is, does a lot of your back pain go away? Does a lot of your neck pain go away? Does it take away half of your pain or more? Are you better able to tolerate the activities that would normally cause your pain? If you get 50% pain relief, improvement in your activities during that short period of time that the numbing medicine lasts, then we think that you might be then a candidate for a radiofrequency ablation. And the radiofrequency ablation, what we would do is go into the same spot that we were testing with those small needles with the numbing medicine, except this time there's a little probe that goes inside the needle. And that probe is going to send out heat and radio signals. And what it does is it destroys that little nerve that supplies the pain to those painful joints. And that can give you pain relief for as long as those nerves remain destroyed. That might be 6 months to a year typically. And what happens is that those nerves are going to unfortunately regrow, and that's when your pain may come back. But at that point, we can usually just go back in there and repeat that heat and radio procedure, the radiofrequency ablation, to calm your pain down for another period of time.